Welcome to the ANEW Insight Podcast, empowering and inspiring your journey to optimal health. Hosted by Dr. Supatra Tovar, clinical psychologist, registered dietitian, fitness expert, and author of Deprogram Diet Culture. Rethink your relationship with food, heal your mind, and live a diet-free life. I follow my guests' journey to optimal health, providing you with the keys to unlock your own wellness path. Tune in and evolve with us. Welcome back to the ANEW Insight Podcast. We are back for the second half of our interview with board-certified neurosurgeon and visionary founder of Recelebrate, Dr. Jeff Gross. Jeff gave us some invaluable insight into his inspiration to found Recelebrate. I am so excited to learn more. This is excellent stuff. Welcome back, Dr. Jeff.
Thank you so much.
Yay. In terms of prevention, could natural killer exosome therapy be a viable option for individuals with genetic predispositions or other high-risk profiles?
I mean, yes, one of the applications theoretically would be to take people who are at high genetic risk or even high epigenetic risk. Like they've been exposed to things that they shouldn't have been, and maybe they worked in a coal mine and they got potential for cancer that's higher than the average bear. Then we could use this perhaps as a suppression or a preventative tool, at least theoretically. I would agree with that.
Wow. And has it been used for high-profile cancer cases?
Not yet.
To your knowledge?
Not yet, but that's one of the groundbreaking things we're working on here, where we want to offer that to people who are at high risk and want to stay in remission.
Yes. Well, give us a picture of the current research as far as who it's been used on, how effective it's been. Maybe give us a few success stories.
Yeah, I mean, amazing research, again, mostly out of Europe and China, as we discussed in our first half. But these are people with circulating tumor cells. So sometimes those are bloodborne cancers like leukemia, things like that. Have had wonderful results there. Also with solid tumors, injecting solid tumors, liver, breast, there are even some brain tumors that have been having amazing results. So again, without chemotherapy, without radiation therapy, without known side effects, showing these solid tumors shrinking. And I mean, that's why we wanted to get our hands on these. We think this is a tool we should offer to people. I mean, one of my jobs is not only to relieve suffering and help people with pain, but protect their rights to access to things that are difficult to get. So since there are no known harm of this type of thing and the results are good and there's medical evidence to back it up, we want to do that for people.
Absolutely. Is there anyone else in the United States who is doing this kind of work, or are you the pioneer?
Well, there are some others I'm part of a group called the Therapeutic Regenerative Exosome Group. And we talk about things like this, and my colleagues will be using these types of things. So I've shared the labs where we can get them. There are very limited doses. When I obtained the first 10 doses of the NK exosomes, there were 40 available from that source. So I basically got 25% of what Europe had at the moment. So my colleagues are offering this and going to be offering this, some of them, and I've talked to functional and integrative oncologists who are using different methods to approach cancer, ivermectin, febendazole or mebendazole, other repurposed pharmaceuticals or anti-parasitic medications, a high-dose IV vitamin C, which is known to be suppressive, fasting, use of berries. This is crazy, but there are wonderful protocols for utilizing like berries or freeze-dried berries, which you can get from Trader Joe's, to help suppress cancer. The phytonutrients are incredibly active in that way. And you can find this on PubMed, which is where we go to look for some medical research, but you won't hear about it from your oncologist who will offer you chemotherapy. Now, I'm not saying ignore chemotherapy, it's wrong. I'm not saying that, but you should know about all options, and you might combine some options. You might use some traditional and some of these natural and cutting edge therapies as well.
Yes. You made me shiver a little talking about ivermectin. Like, oh no. But how is it used in the correct way?
Well, I mean, we are seeing, and studies are arising, that ivermectin combined with either mebendazole or febendazole, which are antibiotics, antiparasitics, can have a cancer reducing effect. There's some discussion of where the dose is or how to use it. And a lot of people who are interested in alternative protocols for cancer or augmentative protocols, adding to a traditional approach, that they can have these things. They have little downside, and we've had ivermectin around, and animals get it. And I see people online that are buying it from Tractor Supply because it's available for horses, and they're just taking a daily oral dose. I guess it comes in a paste or something. So you can get the pills. You can have access to this, and why not?
Yeah, absolutely. But best under the care of your doctor, I would assume. And give me a picture too. It's promising to hear about high dose intravenous vitamin C. That I thought was kind of poo-pooed for a while, but
it's a no-brainer. It's vitamin C, and it's highly antioxidative. It helps repair. So it's cancer suppressing. Again, go to PubMed, type it in. There are protocols that go back decades.
Yes, I think it's so exciting to hear about this.
Yeah.
Give me a picture too of the primary barriers to widespread access to NK cell derived exosomes, and how have you been able to overcome them at Recelebrate?
I just made the right connections is how I overcame it, but and I was persistent, just like I am with my patients. We want to help them get better. But I think that the first part is, as I noted, NK cells are only a very small percent of the immune system. So when these are harvested from amniotic fluid or umbilical cord cells, it's a very, very small percentage. So you have to go through a lot of cells to find a few NK cells. And then they have to go into the right cell culture, petri dish type situation, and produce enough exosomes. It's laborious. I mean, it's very, I'm going to call it factory intensive, or lab intensive. So, and then you have to accumulate it over time. So the labs that produce them are getting better at that. And it's a very difficult process. So it's not something you could just do.
Wow. So what needs to happen to make this treatment more accessible to most people?
I think that as the labs have found more efficient ways to collect and harvest these exosomes from the NK cells, and also collecting the NK cells, we will have more access to them. As the protocols become more refined, how to inject, for example, we are in the process of putting together a state-of-the-art robotic 3D guided injection center so we can inject solid tumors anywhere in the body. Probably not going to be doing the brain right away, but the rest of the body, yes. So we can be precise in how we deliver it. So you don't have to poison the whole body necessarily with chemotherapy to take out a tumor, which would be great, right? This is more what we call precision medicine or targeted medicine.
Yes. Can we do that for dogs too? I just had to see my dog through radiation and chemotherapy, and luckily he's fine, but I can assume that maybe that will be available for vets as well someday.
Listen, a lot of the stem cell research came out of the thoroughbred horse cottage industry. Those folks who invest in these horses spared no expense. So a lot of early stem cell work came out of those guys. And some of the first human adopters were horse owners, ranchers, and racehorse owners.
Oh, I love that. Well, I do work through the Healing Equine Ranch, so my partner Kiki will be very happy to hear that. Her horses are so precious to her. Give me a case study or a patient story where this therapy led to significant improvement or even remission.
Well, we're just in the beginning of that on my end, so I don't have my own stories. We are using these in clinical practice now. Most of my success stories have come from using regular stem cell derived exosomes. We treat many other things, all the way from joint degeneration, helping people avoid knee replacement surgery, for example, spine issues, hyperinflamed states, autoimmune problems, long COVID, Lyme's, things like that, all the way through recovering from heart attack, stroke, and even preventative. We have biohackers and preventative longevity seekers that come in for routine. I'm one of them. My wife and I do this. My mother comes in for exosomes, my stepfather, many people, and they're in their 80s, and they have a 4 to 6 months boost in energy and It's like that movie Cocoon. They got a little dose of youth. So
Oh,
that's
I love that movie so much. Well, let's delve into longevity science. Give me a picture. You just kind of gave me a little bit of an overview, but go into that a little bit more. How do these exosomes support immune rejuvenation, and what role do they play in anti-aging medicine?
well, we talked about stem cells, and of course, stem cell derived exosomes being immunomodulatory. They support the immune system. So if you need a boost to your immune system, these will help activate and awaken the stem cells in your immune system to put out, if you will.
Mm,
So we've seen this time and time again, and we know that because the majority of our stem cells, not all, but the majority live in our bone marrow, where
mhm,
those hematopoietic cells are doing their job to make red blood cells, to make white blood cells, to stimulate the immune system. Because the immune system gets cranky and bogged down in cobwebs from all the inflammation, just like all of our other cells. So
mhm,
we need that. We're also seeing, interestingly, supporting your bone. I said earlier, supporting your bone density and your muscle mass are correlated with longevity. So supporting your bone density is because you're supporting your own stem cell system, right? So
mhm,
if you have osteoporosis, your bones are being bleached out and your bone marrow is converting into fat, right? A
mhm,
red to yellow bone marrow conversion. And that means you have fewer stem cells. So we do have improvement in when we infuse stem cell derived exosomes into people, we have improvement sometimes in their bone density. And
mhm,
we have one of the early uses of the exosomes actually was to heal a fracture or to a hip that has undergone what's called avascular necrosis or osteonecrosis.
mhm,
So those hips usually need replacement, but this was well demonstrated by the French about 20 years ago that you can inject these biologics into the bone of the hip and reanimate the cells and the life of the bone marrow within the hip. So that's all we're doing. It's kind of too easy, if I can say.
That's incredible. But you don't hear about it at all. You hear if somebody breaks their hip, they have to have a hip replacement, they've got something going on with their
Yeah.
knee, they need surgery. Is it the same kind of forces at work against these therapies from industries that don't want this stuff out there?
Maybe it's just not mainstream. They're not teaching this in med schools. And
Mm,
what you learn from your professors is what they learned 20 years earlier and what their professors learned 20 years earlier. And things are just not moving fast enough in that field. So you're not going to get that option if you go see someone who hasn't opened their mind to it. So if you had asked me 7, 8 years ago, before I made the switch, hey, I've got spine pain. Is there a stem cell option? My answer was, I don't know. I really haven't studied that. Right? Some doctors are flat out, no, it's not proven. It's illegal. These myths come up, and really, what they need to do is open a different book and do a
mhm.
little updated reading.
Yes. Does it help with things like arthritis as well?
That's the number one thing we address at my practice is osteoarthritis, which is degeneration of joints. We take people who are bone on bone, who are looking at knee replacement or some kind of joint replacement, and we try to help them not need that anymore, put it off. There's always going to be some role for surgery, but if we can diminish the hundreds of thousands of joint replacements done every year, I think we're helping, because those are big surgeries with lots of recovery and downtime and pain, and a simple injection of stem cell derived exosomes. Why not try it?
Oh
You
my
know,
gosh. Yes, maybe it'll help my I have a little tiny arthritis in the back of my neck here. So I might be coming to you. You're in California, right?
I know we closed the California location and we're only here in the Las Vegas area now. Sorry,
Yeah.
everybody, but California's a beautiful place. They just have some issues that need to work out before I come back.
Oh, gotcha. I
Yeah.
hear you. Okay. Well, now walk me through a typical, if there is one, biohacker and what they are wanting to do and how what it's the procedure look like, and if you feel comfortable enough in telling us what it might cost the
Yeah.
biohacker, walk us through their treatment.
Yeah, so we deconstruct everyone individually. So, like I said, we go through all the epigenetic things. Let's look at your sleep, your diet, your supplements, your nutrition, your exercise regimen, your supplements. We might do some lab tests. Some people already have them. We might do a biological age test. We might look deeper at inflammatory markers, stuff your regular doctor may not order because it's atypical. These are specialty items, right, that we look at. And we tweak all that. Sometimes we're talking about bioidentical hormone optimization, both men and women. The school of thought on that is if you can maintain your usual youthful hormone profile, you are fighting against inflammation and you're fighting against aging, and you'll slow down the age-related changes, and et cetera. So we look at all of that, and only then, if there's still issues we want to deal with, and might just be preventative, then we look at the regenerative side of things. And we have access to stem cells, we have access to PRP, we have access to exosomes. PRP is very low power. It can help, and we realize that, but we've really focused on the stem cell and exosome side of things. We have found, at least in my practice, exosomes are no less useful than stem cells, but they're about a third of the cost. So all things created equal, I'm a stem cell derived exosome fan for my preventative and anti-inflammatory crowd.
So what would that cost the typical biohacker? Say that they want to come in, they want to get that full lab workup, they want all of the recommendations that you have to give about diet, lifestyle, exercise, and then they want exosome treatment. Is it covered by insurance?
Not generally, unless they have a health savings account or a flexible spending account where they get to control the health dollars. But you can deduct as a tax deductible expense above a certain percentage of your adjusted gross. I'm not a tax professional. I sound like I might be one, but I've heard this before.
That's just like
you can deduct a certain amount. There's an exclusion at the bottom end, certain percentage of your AGI. It used to be 3%. I think it's 7.5% or something now. I don't know. But so you can at least deduct it. So you can at least get, in California, that means you get half your money back or more.
Wow, that's great.
Yeah. So in at least off your taxes. In terms of the health savings and the flexible spending account, it's a great way to use those funds. But the workup with all the fancy labs and tests might be $1,000-ish. And then the IV exosomes, let's say you did one, you want to try one treatment, depends on the dose we use. So a starting dose might be 5 cc's, which is about 1.3 trillion exosome particles by count, plus it has growth factors and all the goodness of PRP and amniotic fluid, which amniotic fluid's magic, right? I mean, if you've ever taken a little aside here, if you ever take a fetus and operate on it, and we used to do that in neurosurgery, right? We would identify by ultrasound something called spina bifida, where the spine was open. Right. And there was research, if you went in through the uterus and closed that opening, the child would have a better outcome long-term. So we noticed, though, when those children were later born, after having that in utero surgery, they'd come out with no scar on their backs. So there's something magic about amniotic fluid, and we're tapping into that magic and trying to make it available to people. So if you went a 5 cc dose, you're looking at around, I don't know, $6,000 give or take for that dose. It's expensive. We have to buy these from the labs that get them from the donors, and so we're down the chain in the process. 10 cc dose is not twice as much. It goes up a little less just because it's the economy of scale. When my mother and stepfather come in, they split 15 cc's, so it's affordable for them, and that's just kind of how we approach it. And some people do that once a year. They do it maybe every 6 months. Just depends on the person, how inflamed the person is, and what benefits they felt. I have some young, healthy people who don't feel a whole lot because they're already super healthy, but their HRV goes up. And for those listeners who don't know what I'm talking about, that's heart rate variability, which you can track on your Apple Watch, your Oura Ring, or your Whoop band, or some of the Garmin devices now, which is a very sensitive health metric about the variability between heartbeats.
And so the exosome therapy improves that.
Yeah.
And that's how the younger people are seeing it.
Yeah.
What about your own personal results? What have you seen do for you?
I do it every few months. I've done 2 cc, I've done 10 cc's. I feel a boost in energy. I feel like I'm more motivated, and cognitively I do a lot of writing. I write textbook chapters on this topic. I write medical journal articles. I write blogs and things. I can write, and I can just, a lot more comes out of my brain clearly. I can recover from workouts quicker, faster, without being achy. Little aches and pains I have accumulated in my 59 years have.
No, you guys, he's 90. He's just saying that.
Yeah, right. It should be. Those go away. I can put on more muscle right after. I've noticed that. So that's important on my workouts to get more out of that. Things like that. I just feel good.
Oh, this is so great. What about your wife? What does she notice?
She'll tell you the same. She's actually a poster child because she had knee issues going way back, old skiing injuries. And so we injected her knees in a targeted way based on an MRI and everything. And we have before and after MRIs on her where we've seen the cartilage in her knee become thicker. So she feels great. She can wear high heels down the stairs again without having to go super slowly. So she'll tell you.
Oh my gosh, this is so promising.
Yeah.
So, and does she notice too? I mean, I think people who biohack want to see more youthful appearance. Does she notice that in herself?
Well, she's already amazingly beautiful, so I want to make sure she sees this podcast later, so I get the credit for that. But we've done micro injections. We have a few little aesthetic things we can do for her. We've done some scalp injections with the exosomes to stimulate some follicle regeneration for thinning hair. So we've got other things we do. We'd have to have a third or fourth podcast to get into those.
Oh my gosh, I think we might have to because this is so interesting. I mean, I'm so excited for the future. And give us a picture. How do you envision this therapy evolving? I mean, could it be a frontline treatment even regular preventative care for others?
It is a frontline treatment. It's available in the US. I'm not the only doctor that has access to stem cells and exosomes. We cannot advertise because the FDA has not approved the marketing claims. So it's very difficult. You won't find us on Google Ads or on Facebook because they will not let us, which is fine. We want to be compliant. So but you search on the internet, you will find on your city, type in regenerative medicine. You're in Southern California, so I have colleagues that practice this there as well. And we all come at it maybe a little bit different, and that's okay. A lot of doctors do anyway. I think one of the holdbacks here will be big pharma is starting to get their fingers in it because they want to monetize it. So that'll raise the price of it, sadly. And we see that already on the cancer side of things. There's another regenerative cancer treatment called CAR T cell, which is like chimeric antigen receptor T cell, which is a very laborious process. You have to take cells out of the body, insert a gene and a cancer gene, get that cell to look angry and foreign and put it back in the body and have the immune system deal with it. But sadly, it looks kind of like the COVID system, right? So we're going to be very careful there. But the big pharma is driving that. They're looking to monetize that. So I feel that for this to become approved for marketing claims, it's going to take a lot of money, and that money's got to come from big pharma, and they're going to increase the price of what you're seeing right now.
Wow. Do you see people skirting around that maybe by going over to Asia or to Europe at this point?
Well, that's what people did for many years. 20 years ago, professional athletes were leaving the country for this. And still, a lot of people go to Mexico or Central America, where there are plenty of places now to get these things. But you don't have to. We have them right here in the US. You just have to find the right place. And I think that there are open-minded doctors willing to put down the Kool-Aid and try something new and better and safe. Now, I'm not allowed to say that. The FDA hasn't approved that word safe, but my patients have not had problems. I can say that. And the medical evidence, the published research has not shown any harmful side effects from these things yet.
Wow, this is amazing. So we sadly are out of time, but we may have to have a third podcast because I could ask you a million questions moving forward. But how do people get a hold of you and how do they work with you? They can just pop over to Vegas somehow. So you give all your information.
People do that. Yeah. So our practice is now called Re-Celebrate because you're celebrating the renewal of your cells. And the spelling is RECELLEBRATE. And as far as I know, if you search that online, we're the only people using that word. So, because we kind of made it up. So you can find us on social media, you can find us online, and there's always a way to opt in, reach out, send us your information. We'd love to meet new people. And for your listeners, for the first 20 callers, I'd be happy to set aside a 30-minute conversation for anyone interested at no cost, because they heard me on. They have to mention your name though.
Oh, awesome. Okay. We will put that in the show notes. Everyone, oh my gosh, you could get a free consult with Dr. Jeff, who's amazing. And I tell you, you do look youthful. You do look healthy. You do look fit. And I'm sure your wife is absolutely gorgeous. And you guys are really optimizing longevity science to help you age with grace. And I think that that's amazing. But beyond that, beyond aging, beyond biohacking, what I think you are doing right now is revolutionary for cancer treatment. And I really hope everybody listens to this and does their research and does their homework. And I think it's just so promising that there's something out there beyond chemo, beyond radiation, beyond surgery and cutting out parts of yourself. I think we're headed into the kind of new frontier for medicine, and I'm so grateful. So thank you so much for coming on the podcast, Dr. Jeff.
Thank you for having me.
You're awesome. And thank you everyone for tuning into the ANEW Insight Podcast. I am really looking forward to the next interview. Hopefully it'll be as good as this one. Thank you and stay tuned, and we'll see you next time.
Thanks for tuning into the ANEW Insight Podcast. Please remember, the contents shared on this podcast is for entertainment purposes only and does not constitute medical advice. You can find us anywhere podcasts are streaming, on YouTube at my.anew.insight and at anew-insight.com under the ANEW Insight Podcast tab. And follow us on our socials at my.anew.insight on Facebook, Instagram, TikTok, and Threads for more updates. Tune in next time and evolve with us.